What is dysautonomia? Well, there are 4 categories of dysautonomia: low sympathetic tone, high sympathetic tone, low vagal tone, and excessive vagal tone. You could use the term parasympathetic instead of vagal, but for the categories, let's just say vagal. Low vagal tone can be seen in the gut and in the heart. You may also see it in the lungs, but this is not as common, and you may see it in the throat. Let's just focus more on the gut and the heart. So low vagal tone in the heart is seen as things like high heart rate, high blood pressure, and palpitations. Low vagal tone in the gut is seen as constipation, poor enzyme release, resulting in poor digestion of food, and also things like reflux. You may also see other issues associated with this, but they're more down the line in regards to, say, liver function, gallbladder function, and pancreatic. When it comes to things like low and high sympathetic tone, we often can conflate that with low and high vagal tone. Low vagal tone is very similar to high or excessive sympathetic tone, and low sympathetic tone is very similar to excessive vagal tone. So in some ways it's easier just to say both for each category rather than categorizing 4. You can just categorize 2. But there are some definite differences between some categories. So let's look at excessive vagal tone. In the gut, that is reflected as something like diarrhea. It can also be reflected as poor digestion as well, because the food is moving through the system too fast. Excessive vagal tone often has other symptoms such as very, very intense fatigue. Now that isn't necessarily bad, but it is a common symptom. Another symptom of excessive vagal tone is nausea. And that's because nausea is a vagal response. You may also have vomiting with that. Excessive vagal tone in the heart results in low heart rate and low blood pressure. That's often a problem because it can result in fainting. This is known as vasovagal syncope. The other thing that I didn't mention about low vagal tone is you can get a fainting type condition with that as well. And that's called postural orthostatic tachycardia syndrome. And that's where there's low vagal tone in the heart. It can be the gut as well, but it's particularly the heart. POTS is seen predominantly in cases where there are other concomitant diseases or conditions, often ehlers-danlos syndrome and hypermobility syndromes. I'll get into that later. So POTS, what is it? Well, put simply, it's where you go from lying down to standing, and the blood has to increase to the brain because the force downwards from gravity stops it. So the blood pressure must increase, heart rate must increase, and it does. And then the body has to stop it from increasing too much, and that's the vagus nerve's role. And it stops high blood pressure and high heart rate. But it does this through baroreceptors. These are stretch receptors in the arteries, and it knows where there's too much blood pressure and lowers it accordingly. In POTS, this just doesn't happen. There are other factors in POTS like dehydration and levels of stress, although that seems to be linked to the vagus nerve anyway, and sometimes particular drugs can induce POTS. So POTS is defined as lying down, then standing up, and your heart rate increases from resting by a minimum of 30 beats per minute. And that's within a 10-minute time frame. So that's how long the test takes. There's another condition we haven't mentioned yet, or two rather, low and high sympathetic tone. Now, one of the things you'll often see with these is that there is some level of damage or compression, it's the same for the vagus nerve, of compression or damage to the sympathetic nerves in the neck or in the thoracic spine area. This is another area of particular interest and is often forgotten when looking at dysautonomia. Low sympathetic tone, one of the key components of it is difficulty with exercise. You're unable to mount a stress response. You find it hard to move around. Often that is reflected as chronic fatigue. But this goes, again, this is very analogous to excessive vagal tone, because often that is coinciding with low sympathetic tone. Low sympathetic tone is also seen in the gut, although it tends to be often mistaken as low or excessive vagal tone, and it's just basically a little bit more motility than normal, whereas excessive vagal tone is diarrhea and going to the toilet quite often, more than 3 times a day. That's the most kind of consistent symptom of that. Excessive sympathetic tone is analogous to low vagal tone. But one of the key things in it is that people will so consistently have high cortisol, high adrenaline, you don't necessarily have to have that with low vagal tone. Cortisol has to be elevated, and so does adrenaline for this to be appropriately diagnosed. The state at which you're in is very, very highly strung, and your heart rate is elevated, your gut motility is non-existent, you'll be constipated. You should find yourself agitated, like I said, but also you'll find yourself having high blood pressure, palpitations, sweating profusely. This is generally the elevated sympathetic state. But it's so easy to misunderstand this and call it that and not realize it's low vagal tone as well. That's an issue we see in the industry. So all of these are generally due to either one of a few different things. Damage to the sympathetic nerves or the parasympathetic nerves, aka vagus nerve, through a chemically induced mechanism, so that's neurotoxins, or compression, and that's mechanical. Then you have things that occur in utero. So if the mother is exposed to stress or chemically neurotoxins during the birthing process or while being pregnant, that can cause damage to the autonomic nervous system or prevent the autonomic nervous system from fully developing. And that can result in this kind of a developmental delay type disorder where the vagus nerve and or the sympathetic nervous system do not fully function. So they're the main types, and that's how they manifest. But if you want more and more information, much more in depth, then have a look at my book.